The kitchen she works in is cleaner than some hospitals. But they do serve rabbit. Rabbit fever fits her symptoms.
Tularemia initially presents with a rash or ulcer near the infection site.
Not if she inhaled it. Chopping the meat with the cleaver could easily aerosolize the bacteria.
Tularemia. Bizarre. Okay, we go with Foreman's Tularemia. Start her on IV chloramphenicol, 25 milligrams per kilogram 4 times a day.
Tularemia is rare, with only about 250 cases per year in the United States. But don't let that low number fool you. This organism, Francisella tularensis, is a small, sneaky, and impressively aggressive. It is a facultative intracellular bacterium, which is just a fancy way of saying it likes to hide inside your cells like a microscopic introvert with bad intentions. Natural reservoirs, mostly rabbits, hares, and rodents. Yes, this is one of those diseases where petting something cute can occasionally lead to something very uncute. Transmission most commonly occurs through tick bites or deer flies. We can also get it from inhaling contaminated dust, ingesting contaminated food or water, or handling infected animals. Even laboratory workers need to be careful because this bug is highly infectious. And here's a fun fact TV loves. Tularemia is considered a potential bioweapon. Symptoms usually start a few days after exposure and often look like a bad flu. Fever, fatigue, anorexia, cough, sore throat, and sometimes gastrointestinal misery. But tularemia doesn't stop there. The most common form is ulceroglandular tularemia, which sounds complicated but basically means a skin ulcer at the entry site plus very angry tender lymph nodes. There's also glandular disease without the ulcer, oculoglandular disease involving the eye, or pharyngeal disease that looks like a nightmare sore throat, and pneumotic tularemia, the most severe form, and typhoidal tularemia, where the symptoms are frustratingly vague. Diagnosis is where things get tricky. Cultures can confirm it, but this organism is picky and requires special media. Serology helps too, though antibodies may not appear for a couple weeks. Supportive findings may include elevated white blood cell counts, thrombocytopenia, mildly elevated liver enzymes. Imaging in pneumotic disease looks like pneumonia. Treatment requires antibiotics, with gentamicin often preferred for severe disease. Alternatives include ciprofloxacin and doxycycline. Interestingly, streptomycin is FDA approved but no longer commonly recommended. Key takeaway: tularemia is uncommon but serious, easily transmissible, and absolutely something clinicians must consider when the history includes ticks, wildlife exposure, or mysterious dramatic lymph nodes.